Awesome. Well, welcome everybody. My name is Gordon Wisbach, chair of the upcoming Surgery in Space SAGE's Next Frontier session. And we're fortunate here to have Jonny Kim with us. He's not able to make it in person, but he's been nice enough to lend his time to allow us to do an interview and share that with the group. A little introduction, Lieutenant Commander Jonny Kim, NASA astronaut, a very storied career. He entered the Navy straight out of high school, quickly moved forward into Navy Special Warfare, working with the SEAL teams. His medic combat experience led him to pursuing medical school, graduated Harvard Medical School in 2016, pursued emergency medicine residency, and then continued to rise to pursuing applying to NASA and became a NASA astronaut. And currently he's training for his first flight. So really appreciate him taking the time out from his studies and preparation to do that.
It's my pleasure.
So I want to start off by asking, what are maybe the top 3 items you can mention about your career? I know this could be a 2-hour conversation or more. Maybe some key elements that you'd like to share.
Yeah, there's a lot I can talk about, and they go from really, really funny to really, really great and really not so great. I would be remiss if I didn't talk about some of the really hard lessons I've learned from war, and I think this would be greatly appreciated by the audience because it's medically based. As you mentioned, I was a SEAL medic, and certainly one of the greatest honors and privileges I've had is serving my fellow teammates, American soldiers, SEALs, Marines, in combat who were under duress and needed medical attention, as well as our Iraqi allies. Those were really really formative experiences for me that inspired me to want to be a physician because, as a combat medic, stop the bleeding, maintain the airway, get a chest seal on, keeping the patient alive long enough so that the surgeons could save lives, that the physicians and emergency nurses could save lives. And so that was very formative for me. And so I have to mention that is certainly one of the top things in my career that I always think fondly of. Another one, which is not so great, but has also taught me and relevant for medicine, is that we have a privilege as physicians to do no harm, to do our very best for our patients. And so I've had a really bad experience actually where a teammate of mine had the wrong medical procedure done. Maybe outside the scope, but an NPA was inserted in someone who had been shot through the face. And so certainly maxillary fractures were involved, and that's not the kind of thing you would probably do. And so that was a superior ranking officer, a physician's assistant, but it goes to show that despite our rank, despite our knowledge, humility is a really important trait in our field. Last one, you got to balance that out with maybe something funnier or just fun. I don't know. It's hard. When I think of all the vast experiences, it always comes back to the people we served with. So I'm sure you can think of all the Marines and sailors that you served with, and it's always the people that bring it home that they make it really worthwhile. So, but the top three things off the top of my mind.
Oh, that's really great. Yeah, certainly we always want to improve the training and preparation to not proceed with procedures that are contraindicated. I appreciate you sharing that. So I think a lot of the audience is going to know, as you prepare for your first flight, as a human being, you're going to potentially have medical problems. Say it was a longer flight. And what goes through your mind about the kind of medical attention? I mean, usually you're in really good shape. You've already been physically evaluated. So we're not saying you're going into the situation with a problem, but things can arise. And what are some of those concerns that come to your mind when going to space flight from a medical perspective?
Yeah. So what's been so great about the International Space Station is that we've had a testing bed for now over 20 years of astronauts living in microgravity for long periods of time and in a relatively safe space, because low Earth orbit is 250 miles away, or specifically the space station about 250 miles away, and orbiting around us. And it's about a 4-hour trip home. Now, it's pretty significant thing to come home early, but it is possible for someone. So 4 hours is not bad. That's better than a lot of remote areas in the world that
Mm-hmm.
can't get medical attention within that time. So we have a great testing bed. And what research and studying physicians tracking astronaut health have shown that we need to be mindful of as we go to the moon, to Mars, further along. It's the obvious one, certainly. So bone density and bone mass. You're going to decrease that. Now, we found ways to combat that. Now, proper dieting, load-bearing exercises, specifically actually load-bearing exercises. But despite all that, there are still changes with the bone. While bone density may not change, there are still certainly some changes at the cellular level that we may not know how to fix. And so it goes to, I think that's certainly an obvious one that we'll have to think about, but there are ways to combat that with exercise and dieting. Now, if we're going to Mars, it becomes maybe more of an engineering challenge of how we're going to incorporate that, because we're going to be very mass constrained. The space station is quite big. We have a huge device, it's called ARED, that allows us to actually load our astronauts in space so that they can do load-bearing exercises. Another one that comes to mind is SANS, Space-Associated Neuroocular Syndrome. And for those unaware, that is, well, as the name describes, a space-associated syndrome that results in deterioration, and specifically near vision, for astronauts who undergo microgravity for long periods of time. It was originally thought to be due to intracranial pressure, and I think that that's certainly a component in the pathophysiology, but we think that there are other additional elements. And so there's a lot of research going on into that. That's a big deal, because if you're going to Mars, you want to make sure you can see. So maybe you could see 2020 when you first
Of course.
launched. And what if you're saying 2050 or 2070? And that's going to obviously be very, very important. Radiation is a tough one. And so there's quite a bit of radiation in space. And devising ways for us to combat that and to be able to safely go on long duration space missions that far out and still be within the scope of what is safe for our astronauts for the long term, so that they don't have, so we don't have astronauts getting cancer down the line, is going to be important. I think another one that maybe not be so obvious is the mental health challenges.
Yeah.
Long duration. And the astronauts on the space station have a lot of technology. They have Wi-Fi, and so we are mindful to have them, to keep them connected with their friends and their family and what's going on in the world. That's going to be really important. I think that we'll just have to be very thoughtful of how we are holistically treating our astronauts for things like that. Those were kind of the big ones off the top of my head. I'm sure that we don't know what we don't know is a really great saying for a lot of things, but it's so true in spaceflight, is that there are variables that you're not even thinking about that will be realized when you do an operational mission.
Yeah, that's great. It really helps us put it in perspective. So, as you know, SAGE is a surgically oriented specialty organization, forefront of moving forward laparoscopy, really forefront of robotics and natural orifice transluminal endoscopic surgery, a lot of minimally invasive options. And as surgeons, we tend to focus on what are the surgery needs, but you just listed some major needs with that are eyesight and bone density and mental health for sure. So even so, that's the case. We still have a surgical audience that'd be curious to know, if you were to go on a couple year mission, not low orbit, but high or beyond orbit, to Mars, and you were going to be gone for 2 to 3 years from surgical care. Is there a role? And this is a question that the audience wants to know. You probably have a quick answer, but is there a role for thinking about what the problems could be? So sometimes the gallbladder causes a problem. Often in young people, the appendix causes a problem and is surgical. Is there a role? Do you hear conversations in your training? Do you think there's a role for prophylactic surgery in those organs?
That's a great question. So there are physicians and scientists much smarter than me that are having these conversations regularly. There's an entire panel within NASA, and they seek out expert opinions in the community about what to think about. And if you're asking me, I feel I represent maybe more the operational side of being an astronaut.
Yes.
With benefit of being able to kind of put a physician hat on as well. I don't know the answer. I don't know what the answer is. I don't know what the role. I would think that we try and reduce our pretest probability as much as we can. We get we're extensively worked up. We have annual physicals that include renal ultrasounds and coronary calcium scores, which aren't typically even done for patients in the age ranges of our astronauts. And that's because we try and risk stratify all of our astronauts. And our physicians they do a phenomenal job of keeping us operational. There are different tiers of hey, this person is medically qualified, but only for a short duration space flight, or this person is fully qualified for a long duration space flight. I don't know if there's going to be more classifications as we go deeper into outer space. There might be, if you happen to screen for a higher pretest probability for developing renal calculi or other problems. And it's an interesting thought and experiment that I don't know if anyone really knows the right answer. I would hope that I don't prophylactically get a cholecystectomy or remove my appendix, but I'm sure really, really smart people are going to weigh the pros and cons and do the appropriate calculus of what needs to be done to ensure mission success. Because we're going to be extremely mass constrained going that far. And obviously there are other technical challenges of performing surgery in microgravity. Right. I don't think that's, as far as I know, that's never been done before. And gravity is harsh, but gravity is a wonderful thing. And our bodies definitely love gravity.
All right. No, great answer. From your perspective, open to the idea, but not settle on whether it's indicated. That's good. So we're up against our time here, unfortunately, and I think it would be really important for you to share some comments about the rising NASA applicants and medical students, trainees, so a little bit of mentoring of what are some of the key items that they should be thinking about if and when pursuing a NASA application.
I'd love to. This is a really interesting time. The year is 2022, and I really feel like the golden age of space exploration is upon us. We have the space station, which has been out for 20 plus years. But we have a movement now where we have commercial entities that are
Right.
seeking sustainable ways to explore space, not
Hmm.
just low Earth orbit, but even beyond. And space, the final frontier, is such a cliche saying, but it really is that last frontier. And physicians interested in pursuing careers, whether they're astronauts or they're flight surgeons or studying aerospace medicine, there's still so much we don't know. So, what I would say for physicians who are interested in the field, one, I think step one, you already have that interest. What we look for in the NASA
Hmm.
Astronaut Corps is not just people who are academically inclined, who love to learn and develop themselves and do research. We look for the operationally minded
Okay.
people that are great teammates under high stress situations. And it's the people that can do it all, that can talk to a class of fifth graders, talk passionately about science, about space exploration, can talk to a panel of academics that can go in the field for 2 weeks and carry a heavy backpack, that can live in confined spaces with their teammates and contribute towards the mission. These are the kind of people that we look
Yeah.
for. So if you're interested in what we do, I encourage you to not just develop yourself academically from a research perspective, but also get operational experience, whether that's in field research or challenging yourself in new adverse situations that require teamwork and resilience.
Oh, awesome. Yeah, no, that's really good. It reminds me of my time, along the way in the Navy, and you get reminded the mission, operational. That's got to be a priority. So that will echo well, and perform as best you can, but be a good teammate and understand the mission. So that's really good. We are running out of time. As sorry as I am for that, I really want to thank you for your time with us, and I think the audience is going to really benefit. If you're open to it, if there's questions, then we'll be able to send those to you, and maybe you can answer them through email or so forth.
I
But
absolutely will.
awesome. Well, Jonny Kim, I really want to appreciate, thank you for your time, and we all wish you luck. We all wish you luck on your preparation and your first flight. It's a tremendous opportunity. Really excited for you.
Sir, it's my pleasure, and thank you for your time.
Awesome.